Hello, my name is Michael Leitman, and I'm Professor of Surgery and Medical Education at the Icahn School of Medicine at Mount Sinai. I'm also the Dean for Graduate Medical Education. On behalf of Dean Dennis Charney, it is my honor to provide you with an update on Mount Sinai's activities around the fight against coronavirus disease. First of all, and on behalf of all of our providers, researchers, and our hospitals, I am proud of the leadership position that Mount Sinai has taken in waging this war. Inside America's epicenter, Mount Sinai has developed novel treatment paradigms that are saving the lives of patients suffering from coronavirus disease. We were one of the first in the country to isolate the antibody for testing, and that provided therapeutic convalescent serum for antibody therapy. Our hospitals have greatly expanded their bed capacity to treat as many New Yorkers that need us. I am sure that you have seen Mount Sinai mentioned on every network and news media outlet throughout this pandemic. Mount Sinai has treated tens of thousands of patients with coronavirus. While the majority do not need to be hospitalized, we have admitted thousands of patients, and about 1 in 4 require admission to an intensive care unit. As of today, more than 2/3 of our patients in our hospitals have coronavirus disease. But these coronavirus patients are also being treated for other unrelated diseases, such as cardiovascular illness, stroke, appendicitis, and some of these patients are even delivering babies every day. Treating these conditions with COVID-19 requires an extraordinary level of expertise found only at Mount Sinai. Most gratifying is that dozens of patients previously admitted for coronavirus are now being discharged from our hospitals every day. Most of all, I'd like to provide you with an update on the work being done by our Mount Sinai residents and fellows. If you are not aware, Mount Sinai has the largest graduate medical education program in the United States. We have more than 2,500 residents and fellows that work in 12 hospitals and centers. Many of our programs are ranked in the top 20 of their specialties. Traditionally, our graduates become top practitioners in their fields, physician leaders, scientists, and educators around the country. Today, our residents and fellows are working in a totally different paradigm. In order to accommodate the tens of thousands of New Yorkers with coronavirus disease, Mount Sinai was one of the first schools to declare a pandemic emergency. That enabled us to temporarily suspend our regular educational programs and provided us with the ability to develop COVID-19 response teams throughout our health system hospitals. These teams are composed of faculty, fellows, residents, nurses, and advanced practice providers. For example, it is common to see teams of rehab medicine attendings working with critical care fellows and residents from surgery, psychiatry, and internal medicine. The number of these teams continues to expand as we have opened up new ICUs and medical floors in the Annenberg lobby, the Guggenheim atrium, outdoor tents on the west side, and on previously closed floors at Mount Sinai Beth Israel. A specific group of Mount Sinai residents and fellows deserves extra special attention. According to most news reports, Elmhurst Hospital is the epicenter of the epicenter in the treatment of New Yorkers with coronavirus disease. More than a week before this pandemic hit our health system, the tsunami of this disease hit this safety net hospital staffed entirely by Mount Sinai residents, fellows, and faculty. Our staff worked tirelessly, saving lives and easing the suffering of the residents from the surrounding community. I am extraordinarily proud of Mount Sinai. I receive calls daily from colleagues and friends around the country on our response to this crisis. Our leadership role has been nothing short of amazing. I am also aware of the tremendous amount of resources that our school and our health system has invested in saving the lives of our community. While Mount Sinai has spared no expense in order to do this work, we need your support. Never in the history of Mount Sinai have we been so challenged, not only in dealing with this public health emergency, but in being able to withstand the financial impact of our unwavering support, commitment to pour resources into meeting this tremendous challenge. As an alumnus, If you regularly give to Mount Sinai, please give now. If you do not regularly give to Mount Sinai, please start now. Any gift will assist us greatly in meeting this greatest challenge of our careers and in the 168-year history of Mount Sinai. Your generosity is needed now, more than ever, to ensure that Mount Sinai will stay around for years to come. Thank you.